One of the things that's unique about free clinics is that they're unique to the communities wherever they serve. And so they're very patient-centered, but they're also personalized to those particular communities. So all the free clinics across the state, whether it's rural or whether it's within the city, based on who they serve, they really do work hard to be so patient-centered and understand the cultures that they're serving that it creates almost more of a family environment for taking care of folks. And it's not transactional. That's one of the challenges, I think, of our more traditional healthcare system. And part of that is because people don't get enough time with their providers. They're rushed through everything, and that's driven by money. And so one of the things that really, I think, establishes free clinics separately from that is that free clinics really try to take a holistic approach. They're trauma-informed. They work with folks with a lot of diversity and people who have a lot of barriers to getting care. And so when you're working in an environment like that, you tend to draw staff that also has big hearts, and we really care about our patients. And I'm not saying traditional healthcare doesn't care about their patients, but we have an edge in the sense that we can be relational because we can take more time with those patients. And we're also used to doing problem solving for kind of every patient. And so we don't, even though we have some standardized procedures and processes for regular medicine, we can kind of tackle whatever individuals are facing. So, if we have a person who's diabetic and they don't have electricity in their home, then we've got to figure out how are they going to keep their insulin cold if they're at home and they need their insulin. And so then we have to go down the path of addressing social determinants of health to really make sure we help get their electricity turned on, or we get some kind of cooler in there or whatever. And so that there's no way to practice medicine in a free clinic without addressing the other social determinants of health. And I think, we've been doing that for years, and so it's ironic to me that there's so much focus on social determinants of health now as if it's some new concept. But, free and charitable clinics have been doing this for years. And it's really the right model. It's really the right model for taking care of people.